Wanted to take a moment or two and talk about what I believe is one of the most destructive forces on the planet as it relates to relationships. And that would be addiction. People who are addicted to a substance or to some sort of behavior that consumes them, which leaves them in a place of not being able to relate to others except for in a selfish fashion. I worked in treatment for many years, treated thousands of addicts and worked with lots of families to try to overcome these issues. One of the things I learned over time was that the way we frame addiction in today's world is it's a disease, and it's biological and it's genetic, and if you use and you kick off the biological markers, then you're in a place where you can never stop you can never get well unless you cease the substance. And I don't believe that anymore. I really think that the issue is pain. I've never met an addict. I've never met anybody who's behaving in a way that's bad, that doesn't have underlying deep and profound pain from their point of view. Now, listen, I was abused as a kid. I grew up in a violent alcoholic home. And so when people say, well, that's why I do it, I'm like, well, because you experience pain doesn't that give you a right or an out for doing it to others. So people say, it's my childhood, that's why I'm acting this way. I'm like, my childhood was bad too, and I'm not harming people, and I'm not destroying myself. So with pain and abuse or trauma, particularly as a child, there always comes with that a message. And that message is that you are no good. You're worthless. You're not good enough. Underneath every behavior that's destructive, and I would say rather than addiction, I would use the word compulsion. All compulsions are the result of a lack of peace. And the reason why we don't have peace isn't because of what's wrong with us. It's because of what happened to us. And so our compulsive behaviors are us trying to overcome the pain, suppress the pain, avoid the pain, not deal with the pain. And as a result, we harm others. So one of my favorite quotes is, the avoidance of pain is the beginning of all unhealthy behavior. So if I'm compulsive, if I have a high level of compulsivity in my life, instead of trying to modify the behavior and not be so compulsive, what I would encourage you to do is look at what's the pain underneath. Now, every single one of us is programmed, geared, wired to not face pain. We want to avoid it. So it feels a little unnatural to start looking for the pain, particularly if we've been in a strong compulsion and we've lost control. The other thing that is imperative for this process to happen in a person is they have to develop a very strong denial system. So you cannot have a strong self-destructive behavior and not have denial. It's absolutely unnatural for us to do harm to ourselves, relationally or physically. It doesn't make any sense unless you realize that the person being self-destructive believes they are no good or not worth it or not worth the skin they're printed in. So if I believe that, again, subconsciously, it's not people, we don't have these conscious thoughts, but if your behavior is consistently self-destructive, then I'm guaranteeing you that you have a belief structure that says you're no good. And the way that I continue to self-harm is I have to deny the reality of what I'm dealing with. So denial becomes the number one issue. That behaviors are secondary to the denial. So it's really important that when you're with an addict, their behavior is crazy, or you're the addict and your behavior is crazy, and you're asking yourself, like, why do I keep doing that? Well, I would say it's because you believe there's no reason for you not to. You're worth being harmed. That's not true. That's a lie. That came from a sick parent. That came from somebody who abused you. That came from a lunatic that did something harmful to you. But no one comes into the world not valuable. We all have what I call intrinsic value. It's 100% within us because we exist. We don't have to go get it. We don't have to go find it. We have it. So if you find yourself to be very compulsive about things, and it can be about lots of things. This is one of the things I get concerned about when we use the word addict, because addict, people tend to think of drugs, alcohol, food, sex, but really people can be self-destructive with any kind of behavior. I see it with anxiety. I see it with isolation. I see it with being good or going to church or working out, or you can, there's a compulsion known as anorexia. What is that? It's not eating. You're skinny, but you're self-destructive. Okay. So there's lots of ways that we can be compulsive and harm ourselves. But if we have denial, it's hard for us to see that. So if you are feeling out of control, if you feel worthless and you have a high level of compulsion, I want to encourage you. Look at where the pain's at. Take some time, back away, write it down. And then talk to somebody who you can trust, who's proven to you over time that they are trustworthy because they've behaved in a way that's not judgmental. They're not going to beat you up or gossip about you, but you can tell them. Maybe you have to find a professional, somebody in therapy that you can really start to unpack this stuff with. But no one gets better by continuing to be in denial. No one changes. Nothing gets better by avoidance. There's just no way around it. We have to deal with what's chasing us. And when we do, we can find real, actual freedom, and our compulsion level can go down, and we can start to really live a life that's relationally healthy instead of relationally destructive.